Okay, good evening, everyone. So today I'm going to be talking about critical appraisal of a journal article. And this, as Gauri mentioned, is a very important topic in the sense that um, we we need to be able to read a literature article and be able to critically appraise the usefulness of it, the applicability, the value of it, the validity of the results, and how it's translatable, etc. Equally important is we also need to be able to critically appraise these articles so that we know how to run our own research in the future, identify the weaknesses so that you will be able to write up your paper better. So all said, this is a very important topic which all trainees have to know, because this is essential for your lifelong learning later as well, because you're going to continue reading papers and things like that, and you need to be able to appraise these papers critically and decide how much you can trust them and how you're going to apply them in your own practice. So what is critical appraisal? Critical appraisal itself is a systematic evaluation of research evidence to assess its trustworthiness, relevance, and value in a specific clinical context. And this actually encompasses the whole point of appraising anything. Because what you're going to do is you're going to do it very systematically. There's a system to it. There is a way of assessing it. And you want to look at how trustworthy it is. Is it relevant to you? And what is the value it gives you in your own clinical context? And it is important because it improves your evidence-based practice and it ensures best patient care. A lot of the time when we read articles, we read it because we think we want to gain knowledge from that particular paper. I mean, while that is an important thing, that shouldn't be the only reason you read papers. It's also so that you can get better evidence for your own practice and you can improve your practice in the future. So just briefly, this segues into evidence-based medicine in the sense that when we critically appraise a paper, we are appraising it so that we can acquire the evidence. And evidence-based medicine, there are 5 steps. First, you define the question. To define the question, you use the PICO tool, which we'll talk about later. And once you have defined the question of the specific clinical problem you're interested in, you search for evidence. Search for evidence via the various libraries, the various online repositories you have. Once you have searched these libraries for the appropriate articles, you then appraise. And this is where critical appraisal comes in. You appraise the articles to see how trustworthy they are, how valuable they are, how useful they are to be put into practice in your own practice. Once you have done that, you decide which evidence you're taking, which evidence you're discarding, and subsequently apply them to your own practice. And finally, you evaluate this application of new knowledge you've gained from your evidence-based search. So that is the whole practice of evidence-based medicine. And critical appraisal here is an important part of that evidence-based medicine practice. So there are multiple steps in critical appraisal. The first step is preliminary reading. When you do a preliminary reading, let's say you found a paper. Now, what do you do with the paper? The first thing you do is you read the abstract. The abstract is basically like the trailer of a film. Okay, if you're going to see, let's say the Avengers film, you'd initially see the trailers first, and you want to see whether the trailers are interesting enough for you to see the whole movie. And that's how abstracts work. It's the trailer for the whole paper, and you read the abstract quickly. It'll take you all of 2 to 3 minutes, and you decide whether the film is interesting enough for you to pay money to watch, right? Once you have done that, you can always skim the article to understand the important points. This includes what the research question is, what is the study type, and what is their key findings. And all of this can actually be acquired through visualization. So a lot of current articles now have got what is called a consort diagram. A consort diagram literally gives you the whole methodology in a very simplified form. So what you see on your right-hand side here is a simple consort diagram, which actually talks about how many patients were enrolled, What was the methodology? Were they randomized? Were they allocated? How were they allocated? What was the analysis and how long were they followed up? All of this will be given in one diagram. And this happens in most prospective cohort studies as well as randomized control studies. As well as even systematic analysis and meta-analysis, you would find something like this. So this initial diagram will tell you in a very brief moment what is the methodology of the paper itself. So when we're looking at a scientific article, just like we look at anatomy of our human body, there's so many different parts of it, and you do it step by step systematically. So as I mentioned, the first thing you're looking for is the abstract. The abstract gives you a summary of the objectives, the methods, and the results. The example of this would be like an article on the randomized control trial of a hernia repair. The abstract will give you the overview of what were the patient group, how many patients were recruited, how many patients were allocated, what was the intervention done, and what was their results. Moving from the abstract, obviously, is introduction. Introduction is usually the first paragraph, which talks about the research question. What is the problem you're facing? What is it you want to study? What is the rationale for studying this problem? And what is the literature review that supports it? That means what is already known about the subject, and what is it you think is unknown, the knowledge gap which you want to fill. And that is the whole role of introduction. It's not to write a whole story or summarize all available literature. It's just to identify the gap in the knowledge and why the rationale of you doing this the certain study. And that's what introduction is supposed to be about. From introduction, you'd move on to methods. Methods is describing the study design, the participant selection, and data analysis. It's very clear. Methods simply tell you how was the study designed, what was the type of study, was it a retrospective, prospective, cohort, randomized control trial, how were the participants chosen, how many participants were taken, how many dropped out, how were they allocated, what intervention was done for them, and as well as what were the techniques used for data analysis. Did you do a simple data analysis, chi-square, a t-student, logistic regression, Kaplan-Meier life survival analysis, etc. It tells you what exactly was done. Next section is the results. The results basically is presentation of data with figures and tables. There is no interpretation here, remember. Results does not interpret. Results is present what you have found as it is. So you're not supposed to say, we found these results and these results mean that. We do not talk about the meaning. We only talk about what was found in these results. And frequently, we try to put that as visualizations, because obviously, visualizations are so much easier to understand and read than actual, written form. So try to put all of this as much as possible in visualization. So if you've got demographic data, put that in a table. If you've got a survival, put that in a Kaplan-Meier. If you've got a logistic regression, put that in as a AUC curve of some sort. You can put it in forest plots, spider charts. So there's so many different ways, interesting ways of presenting your data, but that's what you do with results. And then you move on to discussion. So the discussion is where you interpret the results you have found. So if you have found a certain high frequency in certain conditions or a certain relationship, then you interpret them. You tell why you think certain things are happening. You tell why a certain type of hernia repair is superior to the standard Scholdi's or a standard anatomical repair. And you compare them with the previous literature. That's what discussion does. And so because we've already introduced literature in introduction, now we go back to discussion and say, this previous paper explained that certain surgical techniques were superior to others. However, in our study, we found it similar or opposite or something other. So that's what you do in discussion. And finally, you come to conclusion. Conclusion is where you reiterate the most significant findings of your study, not all your study, but the most significant findings of your study, as well as your future recommendations, how this study can be improved, how it can be replicated, or where is the future direction of this study. And this whole thing is the anatomy of a scientific article. It follows the IMRAD technique. If you all know, it's I for introduction, M for methods, R for results, D for discussion. And you add on the conclusion at the back. So this is a standard way of how articles are written, and this is what you use as your template to assess the paper you're going to critically appraise. So moving on, before you start the appraisal, you must generally assess the paper itself. And the first thing you do is you look at the journal. Is the journal a good journal? Is it of high impact factor? Is it a peer-reviewed journal, etc.? So first thing first is you look at the journal. Then you move on to the title and publication. Is it a recent publication? There's no point reading an article which was published 10, 15, 20 years ago, unless it was a landmark, groundbreaking article. These kind of articles are probably superseded by more relevant recent articles. So you have to see recency. You have to see relevancy. Is it relevant to your current practice? Again, there's no point talking about old style open surgeries when a lot of abdominal surgeries have now moved to laparoscopy or robotics, etc. So maybe the relevancy is not there anymore. So these are the kind of things you have to look at in your general assessment. The title of the article, the publication date, the journal itself. And that's how you assess whether the article is of interest to you. An example is a recent study from 2023 on enhanced recovery protocols following colorectal surgery. That's interesting. It was published in Lancet, as opposed to another study on anesthetic recovery protocols in 2008 in a non-indexed journal. If you compare both of these, obviously you want to read the higher impact peer-reviewed journal of a more recent date, right? Next, moving on. You're going to read, you're going to talk, you're going to check the authors and their affiliation. So frequently, even though I put here that the authors recognized experts in the field, we don't know who the recognized experts are. Frequently, all over the world, we've got currently about 50,000 medical articles being published every year. There's no way you know who the experts are unless they are world famous. So as much as you'd want to know whether they are recognized experts, this is not so important. The institution itself, again, is it reputable? Is it known for this particular research? It actually improves the importance of the article, but it's not essential. So both of this, author and affiliation, while it actually makes the article more important and relevant, it is not essential. So even if you don't recognize the author, if you don't recognize the institution, as long as it's relevant and recent and it's published in a good journal, you still should consider reading it for the information it contains. Moving on to the critical appraisal itself, the critical appraisal proper. So the first question is assess the research question. So what is the research question? Remember, I've given to you all talks on how to start your research as well as research question. The research question is very important when you start your proposal, you start your research. Similarly, it's very important when you do your critical appraisal. It has to be clearly defined and it must be clinically relevant. It must address a specific problem that affects surgical outcome. So that is essential when you apply this critical appraisal. So if you are actually assessing this article, you have to tell us the research question in this paper was clearly defined, and this is the research question. It is of relevance to our practice currently, and it specifically addresses this specific area of surgical research. An example is, does robotic surgery reduce complications compared to traditional laparoscopy in colorectal cancer patients? So it is very clearly defined, the research question. You want to know whether robotic surgery is better than laparoscopy. And it's a specific problem. It's not general, does robotic surgery reduce complications in all surgeries? We want it very specific in colorectal cancer patients, right? You need to know why the question was asked, as in the rationale for that question itself. Does it fill a knowledge gap? There must be a gap in knowledge. You must always look at the literature to see what has already been published about this article, about this topic, And then you assess what has not been published and what is unknown. And that's the knowledge gap. So you need to identify the knowledge gap, and that knowledge gap must be very clear in your paper, right? Again, sometimes it could also be because there's conflicting evidence. Or knowledge gap is usually because there's absence of evidence. But on the other hand, there's also sometimes conflicting evidence. You've got about 10 papers saying laparoscopic surgery is better, while another 6 or 7 saying robotic surgery is better, which means there's a lot of conflict in the evidence, right? And in that case, it's still worth actually assessing this, and that makes the research question important. To assess a good research question, I've presented this to you all before, but to assess a good research question, you can use the FINER criteria. The FINER criteria is very simple. F for feasibility, I for interesting, N for novel, E for ethical, R for relevant. So you look at your research question and see, is it a feasible research? Is it interesting? Is it new? Is it ethical? Is it relevant? Take, for example, does robotic surgery reduce complications compared to traditional laparoscopic surgery? It is feasible. You can compare. We've got a robot now. We've got laparoscopy, so you can compare both of that. It is interesting because robotic surgery has become more and more popular now. It is novel. Maybe that's a difficult question to answer. Is it ethical? At this point in time, it's still ethical to implement this. And is it relevant? Of course it is. So this is the kind of a sieve you use to assess your research question, to see whether that article you're reading actually has got a good research question. That good research question must be able to tick all these boxes. It must be feasible, it must be interesting, it must be novel, it must be ethical, or at least tick most of these boxes, even if not all. At least 3 out of these 5 must be ticked for the article to be worth reading. You can use the FINER criteria for your research question, but how do you assess your methodology? So the methodology of any paper, you can assess with a PICO framework. A PICO framework consists of population, intervention, comparison, and outcome. Okay, and you have to, that methodology must be very clear. What is the population? The population is patients undergoing laparoscopic cholecystectomy. What is the intervention? The intervention could be shorter preoperative fasting times, or it could be robotic surgery or something like that. Sorry, and what is the comparator? Again, comparator in this case is standard fasting protocols. The outcome is incidence of post-op nausea, vomiting complications. So it's very clear when you see a PICO framework like this. The paper is very clear on what it wants to do. It wants to study preoperative fasting. Does preoperative fasting reduce the post-operative complications in the patients undergoing laparoscopic cholecystectomy? And I can understand what they're trying to do, which means by the time the results come about, I'll be able to analyze it and see the validity and replicability myself. So we've moved on from introduction to methodology now. In the methodology section, you want to look at the study design. What's the correct study design used? So you can have cohort studies. Cohort studies can be retrospective or prospective. You can have randomized control trials. You can have systematic analysis, meta-analysis, etc. But they must all be used appropriately. Everything has its correct place. So if you want to compare 2 different interventions of similar efficacy, then you want to use a randomized control trial. If you've got a rare disease, you want to do a retrospective analysis. If you've got small sample population, then of course you want to do retrospective. If you want to do cost and effect implications, then you want to do long-term prospective studies. So these are the kind of reasons to choose the various different study methodologies. And your role here when you critically appraise is to see whether the correct study design was used. You have to look at the inclusion-exclusion criteria and see if they are well-defined and justified, and whether they have limited their confounding variables. Because the confounding variables, that means things that actually make a difference in your study, must be accounted for. So just to explain what confounding variables are, an example is you're looking for wound infection due to prep, skin prep, okay? However, you have not assessed whether patients have got diabetes or not. that means you have not limited the confounding variables. You must assess diabetes, nutritional status, etc., and you must make sure that is accounted for before you look at whether the skin prep makes a difference in your infection rates. Because if you don't look at them, how do you know that the diabetes was not the one which was causing infection? And that's the confounding variables. So in your own paper appraisal, you need to see, was the inclusion-exclusion criteria justified? Did they actually think about the confounding variables and remove them as and limit them as necessary? Moving on, bias. Bias is very, very difficult. So bias basically is a systematic error that happens in a study due to certain inherent features of the study. So one way to control the bias is, was the study blinded? Was there any sources of selection or confounding biases, etc.? I think I've got bias somewhere. I'll come back to bias again later, because I do talk about bias at a later point. Okay. Moving on, sample size and power. This is something always vexing you all. So read the paper and see whether they have actually done a adequate sample size and power. So when you talk about sample size, you need to know whether the sample size was large enough to detect a statistically significant difference. If you don't do a large enough sample size and you get a non-significant difference, that study may not be valid. This is how you look at the validity. Similarly, in retrospective studies, you can look at the power calculations to see whether the study was adequately powered, because you can't do a sample size calculation in retrospective studies. All you can do is see whether the study is adequately powered. So moving on to validity and reliability. Again, this is part of the methodology of that paper you're appraising. You want to know whether there is internal and external validity. When you talk about internal validity, you want to know whether the results are likely to be free from bias and were the confounding variables controlled. I spoke about this earlier. But external validity, on the other hand, is you want to see whether the findings are generalizable to your own practice. So, for example, a study from a single urban academic center like may not be applicable to rural community hospitals in Sabah, Sarawak, or even the interiors of Pahang and Kedah and where not. So you have to be very clear. Certain studies are generalizable, certain studies are not. And that is due to the character of the methodology of the patient population selection, of the bias limitations. And these are the kind of things you have to you have to actually discuss in your critical appraisal. So these are the various different studies that are available, okay? And this pyramid is something you all should be very, very clear about. And it goes from the base to the top in increasing evidence of, increasing strength of evidence. So we can start with animal research, in vitro test tube research, to animal research, to opinions, editorials, case reports, cross-sectional case control, cohort studies, both retrospective and prospective, a randomized control study, and finally systematic reviews and meta-analysis. So these are the various different types of study that you will encounter in your critical appraisal. And you have to allocate the strength according to this pyramid, which one is actually stronger than the next. So we have covered introduction, we have covered research questions, we have covered methodology. We're moving to data presentation under the results segment. So when we present the data, you need to be very clear. Were the results presented in a clear manner? Was there appropriate tables and figures? Are the baseline demographics similar? Again, you would have noticed when you do your own research, we ask for p-values in the demographic data. We don't want to see a p-value which is significant in these data. This is the one area where we don't want p-value which is significant, because a significant p-value in your demographics means the baseline demographics are not similar, in which case you cannot compare the two groups. So I hope you all understand this. The baseline demographics are the only data where we want p not significant. Okay. Moving on to statistical tests, you need to know whether appropriate tests are being used. So means chi-square for categorical, t-test for continuous data. You must use the appropriate test in the appropriate place. And you must be very clear about statistical versus clinical significance. This is very, very common in when you read papers. Just because something is statistically significant does not mean it is clinically significant. At the end of the day, a p-value is just statistics. it doesn't mean clinical significance. So be very careful. Even though they are statistically significant, you have to interpret the clinical meaningfulness. An example is a 1-day reduction or a half a day reduction in hospital stay may be statistically significant, but may not be clinically relevant as it does not reduce the complications, the cost, or any of the other factors you're looking for. So just because statistically you can actually find it reduced doesn't mean it is clinically significant. Please remember that. You must also look at the various different statistical results presented. So what is a p-value? You must know what the confidence interval is, the power, effect size, standard deviations presented. All of this actually must be analyzed during your critical appraisal. And then we move on to the interpretation of results. You have to see whether the results being presented align with the study hypothesis and research question. Because in the introduction, they would have already said, we are looking at this study because we presume something like this is going to happen. And then you want to see whether the results align with that. Are they consistent with previous literature? If they're not consistent with previous literature, later in the discussion, you want to know why it's not consistent and what is the causing the differences. And you also want to know the limitations. Are the study's limitation clearly acknowledged? Was there any potential source of bias that is not been addressed? These are things you must know. So, for example, limitation. A single standard study usually reduces generalizability. A small sample size usually reduces power to detect small effect sizes. And a short follow-up duration may miss long-term complications. So these are the kind of examples of limitations that have impact on the study. And you have to mention this in your critical appraisal, as well as when you do your own papers, you can use these concepts to explain the limitations. And once you've finished your limitations, etc., now you want to look at your application to clinical practice itself. You want to know how these results can actually be can actually influence your own practice. Can this study findings be applied to your patient population? Remember, a lot of these studies are being done in the Western world. So in a Western world with their kind of resources and their kind of investigative capabilities, can we do the same thing? Can we do detailed genetic analysis for every patient who comes in? Can we actually do the kind of interventions they're talking about? So you have to see whether this is applicable to clinical practice. For the longest period, robotic surgery was not applicable to our own clinical practice, primarily because we didn't have a robot in our setup, right? So you also want to know whether the results are feasible in your clinical setting. This must always be presented in your critical appraisal, because there's no point reading an article if you're not going to translate it into your own practice. That's the whole point of reading the article and applying evidence-based practice. You also want to look at the cost and practice implications. What are the implications of adopting new findings? You want to know it in terms of cost, the workflow. You want to know, for example, down here, we are talking about the proposed change to robotic surgery from laparoscopic surgery. So you can see that the current practice with laparoscopic surgery duration is 3 hours, but with robotic surgery, it goes down to 2.5, or maybe go up to 5. So if it goes down, then it's a benefit. If it goes higher, then it's a cost. When it comes to equipment costs, you already have equipment costs, but for robotic surgery, you have got all your consumables, which cost 10,000 per surgery, which actually increases the cost. When you talk about post-op complications, you are talking about whether it actually is going to be beneficial or not. So these are the kind of things you want to look at to see whether these things are beneficial for your practice. Yes, so I'm coming back to the biases I talked about earlier. When you read this paper, one of the important things along with clinical application you have to mention is the biases inherent in that paper. Every study has inherent bias. It's something we cannot escape from. It's a matter of identifying that bias and limiting it or minimizing it. That's the best you can do. So the first step, as I mentioned, is identifying the bias. So you need to know whether it's a selection bias, a performance bias, a detection bias. There are so many different types of bias. And you need to also identify what are the best methods to minimize each bias, whether by randomization, by blinding, using proper control groups, etc. Again, if the list of bias is exhaustive, is really long, no, right? And you can't really read everything, but it'll be interesting for you to read some of these very interesting biases like non-response bias, a healthy worker effect. Healthy worker effect is something a lot of y'all will get into trouble with, primarily because you take your study populations from healthier general population. You've got things like prevalence bias, selective survival bias. Survival bias is because these are you're selecting the patients who are actually surviving rather than non-surviving. So there are so many different types of biases. Referral bias is another one we see, especially in UM. So you have to apply this lens onto that critical appraisal itself to see whether the authors of that paper have actually picked up the bias, identified them, minimized them, or completely ignored them. If they have picked it up and at least identified them, you know they've done a good job. If they've completely ignored them, you know then you have to be careful about the validity of the results itself. Moving on, we're coming to the last parts. What about the conclusion? So you want to appraise the conclusions. What you're trying to find here is you want to know whether the conclusions are justified by the results. A lot of the times you would read the whole article, you would see the results, you see the discussion, and then suddenly the conclusion is something completely out of the way. That means it has not been based on the data that has been presented. They're just making things up. In that case, it becomes a dangerous paper. It is wrong, and it cannot be, it's not reliable or valid, and you cannot use it in your own practice. Similarly, more often than wrong conclusions, frequently authors attempt to overstate the implications of the study. They would have found a small p-value of 0.05 for a small thing, and they'd say this makes a big difference in the whole way we practice surgery and medicine. So be very careful. The authors can frequently overstate the implications of a small difference, right? So these are the kind of things you must pay attention to. And applicability, I've already talked earlier. Can the conclusion be applied to your patient population? And you have to mention how will it affect your decision making. You have to tell us, are you going to change your practice based on this paper? Are you now going to move to a robotic surgery or a shorter preoperative fasting or ERAS protocols because the paper says so and you trust the findings of the paper? So that has to be part of your conclusion. And final checklist, you go back again, check the research question, where you have to know the rationale why the question was asked. You have to know how they did the study and what did they do. You have to know what were the results and what did they conclude. And you finally need to know what you want to do with this information and will it change your practice. This summarizes the whole critical appraisal of your article. So when you critically appraise an article, these are the main questions you have to keep in your mind and use. There are so many different tools you can use for critical appraisal. The CASP tools, which are available online, actually tells you different types of questions you need to ask for the different study groups. So all of this you can actually download from your online reading itself. Okay, but my main takeaway would be critical appraisal improves clinical decision making by systematically evaluating research. And this allows us to incorporate the best evidence into surgical practice. So apply these steps, not just for your exams, not just for your journal clubs, but for continuous learning and improving patient care, because this must be a lifelong learning process. And that's why critical appraisal is essential for you in your practice as a surgeon. I think I'm done. Gauri, you want to conclude?
Yes. Okay, maybe first I'll open to ask whether anyone else has questions which they would like to ask you before I ask one or two questions just to make it interesting.
I think you can start first before I'm sure if there are questions they will already bring it up.
Okay, so my question here is, well, to using this, I know it's not really for exams, but in exams they don't need to go in this depth. I mean, of it in terms of like if they are sitting for this at a Viva booth, what is it that they should be foreseeing? One. Two is, do you think they can practice by using AI as a tool on how well to critically appraise, like as a way to guide them on how to learn how to appraise?
One by one.
Okay,
Let's
yeah.
do the first one first. The first one was critical appraisal during exams. So this is a particularly common, it is a table for general surgery. It's not so much for peds and neurosurgery, but for those who are in general surgery, this is one of your Viva tables during your final exams. And usually what we do is we will give you the abstract to read during your rest station, and we would ask you to quickly do a critical appraisal. So the steps are very similar to what I've told you. You tell us what's the title, what's the authors, where is it coming from, what type of study is it, what's the research question, what was their summary of their results and findings, and whether it's applicable to your practice. Based on your knowledge, how different is it from literature, and is it applicable? Sometimes what we do is we add on, during the actual exam itself, we give you the full paper and ask you to interpret either one of the tables or one of the results. So we'd give you maybe, let's say, the demographic table or the consort diagram or the Kaplan-Meier or forest plot, and ask you to tell us, can you interpret these results for us? So the whole station is only 10 minutes. So we don't really have that much time to ask too many questions, but that's about the general way we ask for general surgery questions. Usually I give a separate lecture for that. I can give that to the general surgeons because it's not of relevance to the peds and neurosurgeons. I can give that separately to the general surgeons. So that's the first question. What is the second one you asked me?
Second one was, for their own practice, how can they improve their practicing besides looking at those checklists? Can they try and run it using AI? Use AI as a tool to learn how to do it.
AI is a good tool to learn, but then remember, it's a tool. So sometimes if we have a hammer in our hand, everything looks like a nail, and we start going, we go around knocking everything into the wall. So the problem with AI, let's start with the benefits of AI. AI is an excellent tool. Okay, used correctly, it will actually help you learn better, more efficiently, more effectively, and things like journal article review. I have done it before. I've actually taken articles, put it in there, and tell them, critically review this article and tell me what are the pros and cons and comparisons. So it does work, but at the same time, it also blunts your own learning process. So in the first place, I would probably advise you all learn yourself first the proper method of assessing and critiquing article before you take shortcuts with AI. Because sometimes you take shortcuts, that's the only thing you know. You don't know how to do it properly.
That comes to asking, whether they have any questions for you.
Yep. Do you all have any questions on this? Whether it's exam related or research related or even your journal club related.
This is the opportunity to ask. Or anything, any clarification? There is a handful of the GS who are going for exams who are here.
Yeah, but the GS exams, I do have a separate, it's very similar, I guess, but I talk in more in depth about what the kind of questions we ask.
Yeah.
But other than that, is there any other questions about this journal article critiquing? It's an important skill for you all to learn, okay? And it will help you throughout your career, not just for your exams. So please do see if you are able to do it during your this one. All right, if there's nothing, I think that we close it. Sorry.
Yeah, so if there's nothing, we can end here. Yeah.
All right, thanks a lot, everyone.
Thank you.